What is wrong with a wealthy society spending 20% of their GDP in
Yeah,
health?
yeah.
What is wrong with that?
Yeah.
Because you know what? In the world we live today is a very globalized world.
Uh-huh.
There are many other countries that can produce cars, refrigerators, televisions at a much cheaper rate than we can manufacture them. But a doctor sitting in Colombia, where I'm from, or in China, cannot look in the ear of your kid and put his arm around you and tell you it's okay. And the healthcare industry provides good middle class jobs for a lot of our communities. And that is a tremendous impact in your community, not only because you're healthier, but these people are, you have 150 families that get fed because you see kids in the office and they take that salary, whatever it is, 30, 50, 60, $70,000, and they multiply it times seven because then they go out and eat dinner with their kids, they buy shoes for their kids, they buy cars, they pay rent, they buy homes. And so maybe it's nothing wrong. We should be okay with spending 20%
Oh,
of
well, maybe we
GDP.
shouldn't be measuring it also as all one thing.
No, you're absolutely right. But I'm just saying when people say we're spending 15 or 70% of GDP in healthcare, I'm saying if you're a very wealthy, very advanced society, maybe that is where the spend should
Uh-huh. It could be, but I
be.
think people would argue that our population and our outcomes are
That's
worse
the
and our
problem.
spend is more. And I would tell you it's because we're looking at it as one big bucket of
Mm.
money and we're only spending less than 5%. I think it's 4.7% on primary care
Who
of
does
that big
50,
bucket of
who
money.
does 50% of the visits?
Right. So we're spending a tiny amount over here. How about we look at that as a percent of GDP and then this interventionist type of care as a percent of GDP and separate it out and
Yes.
then look at the value.
Yes. And then there's a phenomenal program that I'm just fascinated. It was in Leah Gagino's podcast. It's called RX Kids. And they're doing it through MSU in Flint, Michigan, and now they're going to expand it to Kalamazoo. And the basic premise is simple. All these social determinants of health can't be factored into a payment formula or quality.
It's so hard and you can't capture them all.
So what they do is a not-for-profit. Every mom that lives in Flint, when she becomes pregnant, she gets a $1,500 gift for whatever need she has during the pregnancy. And for the first 12 months of the baby, she gets a $500 gift. There's no income restrictions. You can make $300,000, you can make $20,000. You still get it if you want it. You can spend it on whatever you want. And they've seen that the
Very
rates of immunizations, the rate of maternal depression, the rate of well child completed visits all improve.
Crazy idea. They had this a couple of years ago, about 10 years ago, one of the managed care Medicaid plans. They would give gift cards to Toys R Us for your child if you went to see the doctor,
Yep.
if your vaccines, if you, all these quality metrics. That if you had 4 kids, you'd end up with a good couple of $100. And you know what? People came in.
Yeah, they
When
did.
my
Yeah,
manager
Of
dangled
course.
the Toys R Us gift cards, hey, come to the doctor, then go shopping at Toys R Us. Really? Do we have to do that? And
Yeah.
sometimes the gift cards added up more than what the doctor's charges were.
Of course they always added more. But what I'm saying is these are the social determinants of health. And again, it's an ethical question.
It's a bride.
No, it's an ethical question. Do we need to support women having children because it's necessary for the survival of our society? And we do. And we do. Do we need women to be healthy? We do. And do we need children to be healthy? We do. And so health insurance is not a good model to incentivize that or support that. So we need to start looking at out of the box solutions that lift pregnant moms and young children out of poverty and provide them with a leg up so that they have a healthy future because it's all selfish. They're going to pay for my Medicare and my care as I age. And without a strong economy, this whole democracy thing that we have,
And
which is
collapse.
great, collapses. And
Yeah.
I'm too old. I can't start all over again. Okay. So I need these young kids to be
You're
strong.
talking to me. My husband is online in the evening looking at homes in the UK to move to, which is where I came from.
I'm moving back to Colombia and it mortifies my dad. He goes, why? I said, because in some cultures, the age, I can't say old, are
Yeah.
treated with respect and kindness.
Yeah.
So I'd rather live in a little apartment where I can afford a maid and a driver and than in a nursing home,
Oh, brother.
right? It's
Okay.
true.